Good afternoon, everyone. I'm Dr. Nikita, Senior Resident in the Department of Psychiatry at NIMHANS. And on behalf of the Department of Psychiatry at NIMHANS, I welcome you all to today's webinar. Organized by the NIMHANS Digital Academy, we are happy to announce a webinar series on anxiety disorders. This series will focus on the various aspects of anxiety disorders, primarily in the Indian subcontinent, and it is scheduled to be held once in 2 months. I thank you all for joining us for the first edition of this exciting webinar series. I now request Dr. Suresh Bharat, Professor of Psychiatry and Head of the NIMHANS Digital Academy, to give the welcome address.
Good afternoon, everyone. This anxiety disorder webinar series was started with a reason. The reason being is since past 8 years, our team, Professor Naveen, Dr. Manjunath, myself, Professor Jagdisha, we are working in community. And in the community, we have seen especially the load, or what we call it as morbidity of anxiety disorder, is too much. Too much in the sense, although the National Mental Health Survey says it is 2 to 3%, if you look at the Western literature, they say up to 10 to 15%. And many a time, these anxiety disorder may not present as anxiety. They may present as substance abuse, or maybe alcohol addiction, or it can be as seen in various other forms, maybe in the cardiology center. So in this regard, to address the public health issue, we need to train many doctors, practitioners, and also we need to prepare a cadre of people who can provide care for these people. In this regard, as a public health initiative from the NIMHANS Digital Academy, we thought of starting this anxiety disorder clinic, which will be spearheaded by our Dr. Manjunath. In this regard, we have planned to start a series of lecture, and invariably it will be given by the private practitioners who are practicing in the area of anxiety disorder, who are well-versed in providing care in the community, so that we learn from them. At the same time, we do not want all the anxiety disorder patients to come to mental hospital. We need to provide care at the community level, and we need to empower the community. So this is the basic agenda why we have started. And in this regard, we have invited our director, Senior Professor Pratima Murthy. Welcome you, ma'am. And also we have the Chairman of National Medical Commission, Professor B.N. Gangadhar. And also we can see there are many senior colleagues, psychiatrists from various parts of the country, including AIMS Rishikesh, and various other places. I will not be able to name all of them. I really appreciate taking time and joining us. I welcome you all. Over to you, Nikita.
Thank you, sir. I would now request Dr. B.N. Gangadhar, sir, the Chairman of the National Medical Commission, to give the inaugural address.
Professor Pratima Murthy, Director of NIMHANS, the team in the community, mental health and telemanas, Dr. Jagdish, Dr. Suresh, Dr. Naveen Kumar, and Dr. Manjunath. I guess he is also there somewhere, whatever it is. There is a very good team that is working towards making mental health services available at doorstep. And thanks to the Government of India, under the able directions of Dr. Pratima Murthy, has launched the Telemanas, which is another milestone in the growth of the mental health services. In this regard, among the mental health services, the commonest among them being the anxiety and anxiety spectrum disorders, it is important that we create services for them also at the doorstep, rather than they having to walk across to specialty center or even to specialists where they may want to get treatment from. I guess the treatment for anxiety disorders, if well educated MBBS doctors and a set of other mental health care providers can also be able to guide these patients and make sure that their conditions get better. So keeping these in mind, the webinar focuses on educating not just psychiatrists, but I'm sure they've also kept in mind other mental health care workers, service providers in this regard. so that they all understand up to what extent they can offer any intervention to these individuals, detecting them, reassuring them, counseling them, providing them with some minimum treatment options, not necessarily only psychotropic medications, but also other alternative forms of treatment. And where things are getting more complicated, obtain a consultation from a specialist, and where in extreme conditions where management may be required as an inpatient in a psychiatric care service or in any of the general hospital where there is an inpatient care service available. So we keep this in mind that the base is full of people, a larger base where people have concerns, not necessarily reaching a syndromic level of anxiety. And so if you intervene, remember moving into the next step, higher step, the disorder, the next higher step, disorder which needs more specialist care and so on. So it is in this context, the webinar becomes very important. I am hope more and more professionals avail this webinar related CME activity, and also make sure that this is available digitally on the website of NIMHANS so that people can, for those who couldn't participate for whatever may be the time constraint that they've had again in their busy schedules, can also watch this and get some form of CME accreditation to their activity. So I wish the team of the Community Mental Health Psychiatry Department in particular and NIMHANS large, I congratulate them and I wish the webinar a grand success. Thank you very much. Good luck.
Thank you so much for your encouraging words, sir. I now request Dr. Pratima Murthy, Senior Professor of Psychiatry and the Director of NIMHANS, to give the presidential address.
Professor B.N. Gangadhar, Chairman of the National Medical Commission and former Director NIMHANS, Dr. Jagdisha, Dr. Suresh, Dr. Naveen, Dr. Manjunath, all the very senior people, as well as the students and various colleagues who've joined today's webinar. A warm welcome to all of you. And it's very encouraging that this particular webinar, which is primarily coordinated by Dr. Manjunath, is focusing on addressing anxiety disorders. I was just thinking, about our very limited training as undergraduates. I remember you had to learn how to differentiate a panic disorder from mitral valve prolapse. That was one important differentiation. And of course, hypothyroidism and acute anxiety. I mean, apart from that, perhaps our training in medical college was very limited in terms, particularly of understanding some of these disorders like anxiety disorders, which have almost become ubiquitous to common mental disorders in practice that we see. Although at NIMHANS, we have tended to see more severe end of the spectrum when it comes to psychiatric disorders, particularly severe mental illness, we are constantly, particularly when we, in the group which does psychotherapy practice, we identify a lot of people either having an anxiety disorder or having prominent anxiety symptoms as part of other disorders. So I think that's an important point which Professor Gangadhar highlighted, that right from symptoms of anxiety to a syndrome of anxiety, we really see an entire spectrum of people who find it very difficult, who often get dysfunctional, and who don't know that they need to seek care. We also know that people by nature may have a lot of trait anxiety, which makes it difficult for them to handle several kinds of stressful situations. And of course, we know that there can be a state of anxiety, which we of course look at as a spectrum of anxiety disorders. And therefore, it becomes very essential for any healthcare provider to understand and pick up these symptoms and to help patients. in some ways, one can say that COVID has actually unearthed a whole lot of people who either had previously anxiety disorders or whose anxiety disorders got manifest or aggravated post-COVID. And there are enough studies all over the world to suggest that common mental disorders have increased all over the world. And of course, we also know that anxiety can very often be mixed with depression, something that is often recognized in community practice as a mixed anxiety disorder presentation. Whatever it is, whether it's particularly among young people, the presence of anxiety symptoms is certainly, very, very obvious. And if you talk to a lot of our colleagues who work in clinical psychology, they do get a lot of young people without any other kind of manifestations who present with a fairly, significant anxiety, which comes in the way of their education, of their work, of their relationships, and of their productivity. In Telemanus too, all of you are aware that Telemanus started on October 10th, 2 years ago. And it has been a flagship program of the Ministry of Health and Family Welfare, Government of India. And one of the common symptoms that people report to, perhaps after sleep disorders, after sleep disturbances, are symptoms of stress and anxiety. And anxiety is very often either a response to stress, or in many people who have a disorder, it possibly occurs de novo. And we know that it presents with both physiological symptoms, which are often mixed, kind of misunderstood as an underlying physical health problem, or with various kinds of psychological symptoms. Another thing that we realize more and more is the concept of health anxiety, particularly in people who have long-standing health-related conditions, and sometimes underlying anxiety or depression actually minimizes the likelihood of complete recovery from that condition, reduces, but maybe increases the chance of discontinuation of medications for those disorders. And now it's very well recognized that particularly for NCDs, dealing with stress and underlying anxiety is very, very important for recovery. So whether it's a primary psychiatric disorder, whether it's occurs secondary to some life situation or to a health condition, I think it's very important to recognize this. I also remember that, anxiety can also lead to a lot of avoidance behaviors. And that again limits the ability of a person to kind of reach their complete potential. And therefore it becomes important from all these strategies, from all these viewpoints, to address, to first of all identify. So, and anxiety is not a very difficult thing to identify once people are attuned to actually how to talk to patients and elicit symptoms. The second thing, of course, is to provide an empathetic relationship, because often along with anxiety comes this worry and, kind of challenge to engage with a treatment professional, helping them to overcome that. And thirdly, providing the appropriate psychological as well as pharmacological treatments. I also think that sometimes people are very, very anxious about going on medication. And sometimes a lot of the practitioners' work is really allaying that anxiety, educating them about the importance of not prolonging their distress, and at the same time teaching them psychological methods in addition to the pharmacotherapy to cope with the underlying condition. So I think there's so many elements that can be, learned from healthcare providers, that can be taught to healthcare providers. And finally, ultimately, I think if more and more healthcare providers learn to, of course, identify it, to rule out other conditions that might mimic anxiety disorders, and to manage them in a comprehensive manner, I think it will provide a lot of help for lakhs of people who are likely to be suffering from this disorder. So it's a great start. And I think generally I must compliment the community team, because in some ways, to take psychiatric practice out of institutions to the community is very important, because I think there are a lot of people out there who need it. The secondly, to engage with the professionals who are working in different kinds of environment so that there can be a lot of mutual learning from each other. Very, very important. And thirdly, I think to spread the word that certainly people can seek help, especially when these disorders are in a moderate and severe category, that they should not delay help seeking and have to suffer it, is another very, very important message that needs to be provided. So I hope this series will really achieve all of that, will improve the dialogue, will improve the will also discuss the challenges in the management of some of these conditions, particularly in some patients, and will help all of us to recognize and to more effectively treat this group of disorders. Congratulations to the team, and wish all the participants a lot of fantastic learning online. Thank you very much.
Thank you for your wonderful and valuable words, ma'am. I now request Dr. Naveen Kumar, Professor of Psychiatry and Head of Community Psychiatry Unit at NIMHANS, to give the vote of thanks.
Thanks, Nikita. It's my proud privilege to propose the vote of thanks by thanking all our teachers. Professor BNG sir is there, Madam is there, the Institute, the department, the NIMHANS Digital Academy, and a lot of colleagues who have joined this webinar series. And of course, last but not the least, the participants, including psychiatrists, psychologists, social workers, and various other disciplines that have come. The support staff who have been instrumental. Of course, the senior resident is there, Nikita is there, Sarandha is there, Professor Jagdish has come, and a lot of other colleagues also have shown interest in taking this anxiety disorders clinic agenda forward. So, so with these things, I think I'll end my vote of thanks, and thanks once again for all the participants. I think we can. Thank you.
Thank you, sir. We now move on to the most awaited part of today's webinar. I have the honor of welcoming Dr. Jagdisha Tirthahalli, Professor of Psychiatry in NIMHANS. He is the former Head of Psychiatric Rehabilitation Services at NIMHANS and is